We've heard a lot of news about death, especially leading up to heart attack in the world of football. Now, news coming in from Rafael Duawina, who was the first on Saturday to we got his news that he was slumped on the field of play and could not continue, as the game could not continue due to Duamina's and in the incident about Rafael Duamina. But as of yesterday, we had the latest news on a Zimbabwean goalkeeper, and that's George Chikova. George Chikova's news yesterday, of course, has brought in a lot of talks about sports and medicine. But to join us in this conversation will be a sport physician, of course, Dr. Opemipo. She'll be joining us all the way from Lagos, Nigeria, to weigh in the options and what's really happening while we are having a lot of death concerning heart attack in the world of football. Thank you so much, Doctor, for joining us on the show.
So thank you for having me.
All right, we would like to know what are the types of heart disease? Because maybe someone out there might not understand when they have symptoms, when they have signs of a heart disease. Let's know what are the types of heart disease that an athlete, a pro athlete, can suffer on the field of play.
Okay, so there are different heart conditions that one can have, even especially athletes, and some of these conditions are age specific. And so for younger athletes, I think one of the common heart conditions that they can have is either congenital heart disease or they can have like a cardiomyopathy, which can be developed over time. And then with older athletes, it could be like coronary arch heart disease. Basically, that one develops over time and could be from um, how do I explain this? Basically, it's like an accumulation of cholesterol in the heart vessels and basically reduces the way the heart can function or pump blood to the rest of the body. So these are just some of the things, or some of the heart diseases that are quite common with athletes.
All right, we got the news about Rafael Duamina, and that was really, really touching because he was diagnosed of heart disease sometime in 2017. Rafael did continue even after that diagnosis, and he also collapsed in 2019 and was forced to retire from football. But he still continued, hoping that, you know, God will be on his side, as he did say. But for one diagnosis, and for an advice to retire, and this player did not yield to that advice to retire, and now just on the 23rd, on the 13th, I beg your pardon, of November 2023, we had the news of his collapse on the field of play, and he was not able to make it even after first aid treatment were administered to him. Now, we did see that video, which is a very, sorry video there, where his teammate had pushed him, turned his head facing the sky. Would you say, if you did watch that video, would you say that the reason why maybe the first aid did not help out to Duamina there, maybe that was the reason why, that's what triggered, the death, because the doctors confirmed that he died even before he got to the hospital. Do you think that first aid treatment, pushing the athletes to face the sky, that's the reason what fastened his death?
No, I don't think so.
Okay.
Because in that particular moment, based on the way he collapsed, the person performing the first aid would have had to do CPR, that's cardiopulmonary resuscitation. And you can't do CPR in any other position except if the patient lying flat on the floor facing the sky, basically. So that particular position in that moment, no, it couldn't have been the cause of his death. Obviously, I think it would have even helped if someone was able to do CPR properly or effectively. That may have helped. But considering the fact that this athlete already had a cardiac condition, and with that condition, he needed to have like an implant and defibrillator attached. for a while, and this is not the first time he collapsed. He had a lot of dominant and risk factors that made him like a candidate for sudden cardiac death.
Okay.
Perhaps if he had the defibrillator, if he still had it, he may have had a better chance of surviving.
But Raphael was put on, he was placed on a defibrillator, and he asked that that defibrillator be removed from him so he can play better. He was placed on one in 2019.
Yeah, and he had it removed. So
yes.
Perhaps if the defibrillator was still in place at the time of the incident, he could have survived.